Hello, I'm Jonathan Colopy, an executive director with the Y of San Diego County, and this is the Y Be Well podcast. I'm very fortunate to have our guest here today, Dr. Benjamin Maxwell, a board certified psychiatrist with Rady Children's Health. Dr. Maxwell, thank you for joining us.
Good to see you, Jonathan. Happy to be back.
Pleasure. Pleasure. So our topic today, and I always love, an expert like yourself that we can kind of go in a lot of different directions, but May is Mental Health Awareness Month. And so overarching mental health checkup, how are we doing collectively? We've come through this, health crisis being declared for
Mm.
youth mental health, more recently, loneliness being epidemic. So where are we today in this moment in time, would you say?
Yeah, I was actually listening to a Beatles album this weekend, and there's a song in there, Getting Better. And I think the lyric goes, It's getting better all the time. And I think we're really at that stage of this at this point. I mean, another part of that lyric is it couldn't get any worse or something like that, right after
Uh,
that, right? So, I mean, look at what we've been through of, say, the past 10 to 15 years, families, young people trying to figure out how they engage with technology. I think that was an unknown for a long time. And I think now we're understanding and learning about the negative impacts of technology on young people, especially, and how we might be able to navigate those. So, knowing some of those things, I think we're at a great place now to find solutions and a way forward. The COVID pandemic, obviously, and restrictions associated with that, very, very difficult and tough on families, young people. My daughter was in preschool at the time. Thinking about what kids missed out on, and now knowing the importance of that social connectedness and social collaboration and fabric that exists in our community, the importance of that, I think, is not taken for granted now.
mm,
And so what I've seen is, as the Surgeon General mentioned, these youth mental health epidemic and social connection problems that we've had in our society, there's been a growing swell of interest and effort to try to find solutions to these things. 5 years ago, if we were talking, it might have been news for people that social disconnection was a problem or that social media might be problematic for your child. Now all that stuff is sort of known, and now we
yeah.
just have to do something about it.
That was just a tremendous learning coming through COVID, that how important community is, that social connection in all, demographics, all ages.
Yeah.
And so I'm encouraged by getting better all the time. Love the Beatles, and just their messages are meaningful and all, and without indefinitely they're meaningful.
Yeah.
So today you're encouraging me. They were moving forward. And so I appreciate that. What do you think is the difference today versus just a couple of years ago?
I think the difference is some of the programs that we've all known needed to be put in place have started to be put in place. Some examples. Rady Children's Hospital has embedded mental health providers into a number of pediatric clinics, and we're going to continue to do that. Our goal is to try to make sure physical health and mental health are cared for equally and sort of in a cohesive way. So that's happening here in our community. At the Y, I mean, the Y's motto, positive youth development through community well-being. And these
Yes.
idea of these two things going hand in hand together, it's very difficult to have positive youth development without community well-being. And so I think what the Y is doing with community-based programs and through the facilities really is allowing for all kids to get access to things that can support their psychological well-being. There's funding coming in from various different government agencies or other agencies to support these sorts of things. I've even had incredible conversations with heads of museums here in the area, thinking about the arts or nature and how those things can play a role. So it feels like this growing momentum
Mm.
towards supporting and the importance of supporting our mental health is really growing, and I'm optimistic because of that.
Dr. Maxwell, I like how you started when you're talking about embedding mental health services in pediatric settings. Uh, that is huge.
Mm,
It shows how important with the recognition of how important mental health is, and
yeah.
to be in that particular setting, to be able to address and then look at how to support mental health for youth at that point is phenomenal. And I would assume we're tracking kind of efficacy and efforts and the impacts of that.
Well, exactly. This is a program that we started during the pandemic. Not the easiest time to start a program like this when people are all in their virtual worlds, but we started embedding these folks into local pediatric primary care offices. So, it doesn't feel like that long ago, but that program has had over 56,000 visits associated with it, touched
Wow.
around 10,000 individual kids' lives. And many times that's, say, a kid with social anxiety or school anxiety, 3, 4 sessions with a therapist in the pediatric primary care home,
Hmm.
and they're back doing really well. And so we've looked at there's obviously lots of anecdotal evidence of kids coming in struggling and pretty quickly going in a positive direction, but we're also doing something called measurement-based care, which measures how these kids are doing. And
Hmm.
early data shows that their anxiety or depressive symptoms are going down by about 70%. So
Phenomenal.
really, really drastic improvement there. And it also appears that we're catching things early so that they don't turn into crises that end up in our emergency department. So it's
Hmm.
saving the healthcare system resources, it's improving outcomes. We think in the long run, it probably costs less to do this as well. So it really ticks all the boxes of what we call value-based care: better outcomes, lower costs, and better patient and provider satisfaction.
I would think, Dr. Maxwell, this would be a model that would, spread to other pediatric settings and beyond, emergency rooms and whatnot, so that
Yep.
we're intervening earlier on, so to
Yep.
speak. One thing that comes up for me, if families or parents are listening to this podcast today, and they have questions or concerns about the mental health, mental well-being of their child, how might we support them? Are there certain things that they should be looking for, certain questions to ask themselves as a parent and or their child?
Yeah, I think one of the big things is change in patterns, change in behavior. So, if a kid all of a sudden was loving playing some sport and now all of a sudden they don't want to go to practice, or if they really liked hanging out with certain group of kids and now they're more withdrawn and isolated. I think those changes in kids' behavior or patterns is really an indicator that something may have changed. And then I think if you see that, having the open-ended questions where you give the kid an opportunity to be heard and be understood. And that can be difficult for parents to do. I know it's difficult for me to do with my own daughter. I want to, how is school? What'd you do in school? Asking very
Yeah.
closed, tight-ended questions in a way that sometimes kids don't respond to.
Mm.
Sometimes it's those moments where maybe you're making dinner and there's just not really much going on, that the opportunity arises that a deeper conversation can happen and you can hopefully aim for understanding rather than aim for advice giving. I think that's probably the first step that parents sometimes get wrong, including myself.
No, it's a great point because we want to fix things and we want to ask questions that we get an answer to. So to do that in a way that is kind of indirect, that you're kind of
Yeah.
floating some things, allows for the child hopefully not to be defensive or guarded, but a little more open to sharing authentically in that way.
Yeah. I'm
Now,
still learning. I'm still learning how to do this myself. So, I mean, do you have any advice for us of how do you do that well?
yeah, it's a great question. I think to hopefully refrain from that impulse to direct the conversation or to fix it. It's the same thing I continue to learn. I've been married for 38 years with my wife, and as she shares, it's the same dynamic of I want to fix it.
Yeah.
This is what needs to be done, or you should do this. But that's not what my wife wants, and I don't think
Right.
that's what my child wants when we raised our children.
Yeah.
They want to kind of be accepted and heard.
Mm.
And so to really, be patient and just create that open forum, so to speak.
Yeah, beautiful.
We'll compare notes moving forward, Dr.
Yeah, I'll
Maxwell.
keep trying to aspire to you.
At what point would it be a concern that a parent should move forward with either a counselor, therapist, or a psychiatric assessment, so to speak?
Yeah, I think the talking with your pediatrician, really, if you have any concern, pediatricians are really this incredible resource that communities have because they see kids growing up in all sorts of different trajectories. And so they can be a good judge of when is something outside of the realm of normal development and when do things need to be addressed. So most kids and families have a trusted pediatrician in their life. And so I think that's a great place to start. The other great place to start is talking to folks at school. Maybe it's a school counselor, teacher, or other administrator at a school. Just another incredible resource that, again, most kids and families have is school teachers and people that are around lots of different kids. So if you're seeing some like one of those trusted individuals saying that, yeah, maybe we need to take this to the next step, then having them help you navigate how you can get the resources that would be needed to help your kid and family.
Excellent, excellent. If I could shift to adults, and
Yeah.
so if you're in a relationship, your partner you may have some concerns about, or yourself, if you're self-aware and you just wonder if I need some support or things don't seem quite right. You mentioned some things, changes in behavior. What else might be helpful for either a partner in relationship or our own self-assessment?
Yeah, there is an incredible free tool called Mental Health Questionnaire by an organization called Sapien Labs. And you can access it online. I can get you a link if we want to put it in the show notes. But
Thank you.
it takes about 10 minutes to go through, and it looks at 6 different domains of psychological well-being. It's really for 14 and up. Mainly, it began as something for adults, and they've done this globally. And you get a whole printout of how you're doing. That'd be one thing. I think another thing would be so that could be your own self-assessment. I think with loved ones in your life, again, it's that opening of conversation, aiming to understand rather than to solve. A really difficult thing to do, but just to maintain that, hey, we all need each other as we
Mhm.
go through life. No one
Yeah.
gets out of this world without some adversity, and trying to be there for your friends, family, and loved ones in a way that they can feel understood and heard. And then, yeah, at some point down the line, figure out how to solve that. But if you can be that person in someone's life, it can be really incredibly powerful.
Yeah, that's a beautiful point. I appreciate that. I'm just trying to think about what you mentioned earlier, how important just organic opportunities. You spoke to the why and how, we focus on positive youth development, and it's an approach that is woven through either in our childcare, our sports, our
Mm.
camps, and it's those interactions where you're there to support that child in terms of discovering some resources within themselves and sharing the power with them in
Yeah.
that aspect. And it's beautiful that there's organic opportunities in sports and what you said earlier that other museums and whatnot are looking at. So we hopefully elevate the mental well-being of all.
Yeah.
And if I was to gently challenge you, Dr. Maxwell, what would be a template for us to tether to in terms of how we go about mental well-being, noting that mental health rises, falls. It's not a flat line, and so how do we tether back and maintain mental well-being?
Yeah, I think, it's an incredible question that I think we're asking as a society at this moment.
Mm,
How do we maintain psychological well-being in the modern world? And I think a starting place is, well, how do we even define what psychological well-being is? And I think the way a definition that resonates with me is the ability to be a productive member of your family, your community, your society, and manage the stresses of day-to-day life. that second part I think is really important that there will be stress associated with day-to-day life. And psychological well-being would be the ability to manage all that and still move forward and being productive in your role. And so how do we do that? Well, I think in the modern world, it's thinking about how we're using technology. It's thinking about what our social connection is through friends, thinking about our families. Families have always been an important part of shouldering burdens and stresses together. I think it's thinking about our exercise and the food we eat. And so, I say that sort of food, family, friends, fun, and phones is PH, but they all kind of start with F.
Yeah.
So I think if we can think about those things and then tether that back to creating an environment for ourselves, our kids, our families, so that we're doing those things in the right balance, that can take care of a lot of the underpinnings of psychological well-being. Now, still, people are going to struggle with things and need support, and clinics and therapists and all those
Yeah.
other things need to be there. But
Yeah.
if we can do our own little part in our own lives with that, hopefully we can build out a system to support people the way they need it.
That's wonderful. I really appreciate that template related to technology, social connection, family, exercise, food. And if we can, look at keeping those things in balance
Yeah.
and engaged. Can technology play a role in supporting mental health? And again, it may be a balance, but I wonder if there's tools within technology.
I think absolutely. Technology is a powerful tool that can be used for good or it can be used for bad. And I think the hope that I have that I was speaking about in the beginning is because there's so much demand for psychological well-being or the support of that, I'm really
Mm,
hopeful that either existing companies or new companies can come along that are going to be creating technologies that support what it means to be human instead of
mm,
degrade what it means to be human. So,
mm.
what if technology was better able to connect us instead of divide us? It's just
That's
one example.
That's beautiful. And I just, you were talking, I was also thinking you offered another piece, that mental health questionnaire with Sabian Labs, just again to raise awareness for us to
Right.
be able to look at an objective measure, so to speak.
Yeah, and we recently collaborated with them on writing a paper of using big data quantitative analysis to come up with new understandings of what are the underpinnings of psychological well-being, something that without technology isn't possible. They use, I don't know, the quantum computing, things that I know nothing about
Mm.
in order to look at big sets of data to understand what keeps us all well. Now, some of the some of the takeaways maybe we all knew, but it's still important in this world to have the data to support the approaches we're taking to help keep people well.
If I could, I like to learn from others, especially an expert like yourself, Dr. Maxwell. I wonder how you go about maintaining that psychological well-being in how you defined it. Being engaged, a productive member, managing day-to-day life stressors. Are there certain practices that are important to you as related to just your own plan to maintain well-being?
Yeah, I think I, like everyone else, is I'm constantly thinking about this. So I think that's one thing that I give myself some grace on, which is it's okay that I don't have it all figured out because the world's rapidly changing. My own individual world is also rapidly changing, but I think about the importance of psychological well-being, number one. I think a major non-negotiable is a family meal. So a family dinner together every night without a TV on where we're talking to each other. And sometimes the conversation is, not a lot just because people have gone through their day and they're all just hungry and we eat. And other times those family meals, even with a 7-year-old, last for 45 minutes after we're all finished eating and we're laughing and having a good time.
Mm,
So that family connection is important. My dad was recently in town for his 75th birthday celebration, and so connection with my immediate family. This summer, I'm going to a family reunion to see my cousins on my mom's side, and there'll be, 50 people together and remembering who I am and where I came from. So those layers of social connection on family side and then with friends is also something I think about a ton.
Mm.
Being a busy dad with a full-time job and a busy job at that, we all have stresses that sort of can pull us away from that.
Mm.
So refocusing energy on that's something I do. And then, similar to what the YMCA encourages of healthy lifestyle through physical activity, healthy foods. I always feel better when I'm eating healthy psychologically than
Yeah,
when I'm eating food that might be convenient but less healthful for me. Um, so I think those are some of the potentially cliche things that I
yeah,
do, but I think the importance of remembering how difficult it is sometimes to do it in the world we live in,
yeah.
something I think about.
I thank you for sharing more personally in that way, just because uh, mental health is dynamic. Also, our times are dynamic.
Yeah.
May have supported our mental well-being 20 years ago is very different today because of all that's in our world. I really appreciate that you reflect on and you're aware of, and how important that family meal is, and
Mm,
then also the extended family, how that there's a grounding nature and anchoring.
yeah.
And I loved your words of remembering who I am.
Mm,
Truly, truly beautiful.
thank you.
Dr. Maxwell, I appreciate your time. Anything else that we need to talk about or needs to be shared? Uh,
No, I mean it's fun to be a part of this. It's incredible to see the work that the YMCA is doing in the community and just grateful to be here in San Diego where we're trying to do our best to find a way forward on this topic.
Dr. Maxwell, thank you so much for all that you do in community and supporting our mental well-being for all. So thank you and wishing you well.
Thank you, Jonathan.
And for all those, stay tuned for our next Why Be Well. And until then, please be well.